Other hormones in our body which are really important for fertility, because many of us have gone through IVF, for instance, and usually until you deal with fertility, pregnancy, IVF, whatever your journey is, you haven't heard about FSH and AMH.
Yeah.
Those are hormones. So I'm so interested. So as a pregnant woman,
what are these?
like FSH
Yeah.
and AMH are not familiar to you, right?
No, they're not.
Amazing. So I went through IVF many times, and FSH is your follicle stimulation hormone, and AMH is anti-Mullerian hormone. Both of these are things that are monitored when you're in, advanced, I would say, fertility cycles. When it's something that is needing to be
when you're doing IVF
checked.
and when you're
Right. However, for the empowerment of women, it's really critical that these levels be checked early on. And this has a lot to do with what's happening in the rest of the body. And so I am a huge advocate, speaking of advocating for women's health, knowing your body, knowing the questions to ask. Every woman in their 20s should ask to have their AMH and their FSH tested, whether they're thinking about getting pregnant or not.
Yeah.
So that you know what's going on with your body.
I actually love that you're saying this now. So I did not know anything about those levels, but I will say, because I talk to friends of my age about this all the time, I went to a wonderful fertility clinic called Kofinis. Highly recommend. I'm just going to plug them in for a consult, just because, again, my type A-ness. Before, my husband and I were talking about the pregnancy journey, I wanted to just know my baseline. That's just how I am. I wanted to know what are all the options, because I find it interesting that, with any sort of fertility doctor or specialist or clinic, they kind of say, you're trying for 6 months to a year before you see them. And I just find that a little backwards sometimes.
Yes.
We go through our 20s and we know nothing about our reproductive health,
Right.
Like our own individual, what is it we are going into pregnancy with?
Yeah.
And I learned so much about myself. And I mean, again, luckily I had all the tools, everything was working in order for me to get pregnant on my own. But I wondered, that's me being able to advocate for myself, finding this specialist to find out information about myself and just know my own reproductive health. And how many people do not know anything until you've been trying, and you don't know the levels and you don't know this and that. I find that so fascinating, like that's not something that's like common practice or common knowledge for us. It should be like, we care about our teeth, we go to the dentist once a year, and yet we know nothing about our reproductive health.
Also, I even have to tell you, don't apologize for being type A. I think often, type A has negative connotations, but really, what does that mean? That means you're proactive. It means you're curious. It means you're organized. Those are positive attributes. So I feel like this is something else we're conditioned to do, which is apologize for our interest. I have been hazed by doctors when I ask questions, and then
for sure,
they treat you like a hypochondriac. And it's like, no, I just want to understand.
I just want to know, and I want to have options as well. We talked about this with I go into a doctor's office, I may have a question. I don't even necessarily know what I'm asking, but I know the information that I want. I just want some options. And so sometimes it can be very difficult. And so like you said, having a team, having a support system. I have I have a doula. I'm able to go to the Lotus method and learn this and that. And I have a physical therapist. But if you don't know the questions to ask and you don't have resources, and that is why we are doing this, ladies and gentlemen, so that, this can become more accessible for everybody, and what questions to ask for yourself in that moment.
And to encourage the conversation. As if that's something anyone should be even remotely apologetic about. Like having understanding and stewardship over our bodies.
Not that.
That we should know what's happening and feel empowered to make those decisions and to have conversations. And I have to say, if people encounter any kind of stigmatization, keep looking, keep searching. You will find women like us. You will find supportive people, regardless of gender, who are interested in having these conversations that may be, anecdotal in some ways because it's a very individualized process.
Yeah.
But therein lies the knowledge.
Yes.
And especially when you find people who are interested in evidence-based practice and understanding fully what's happening, that's where we can bond and support each other as a community, which is everything, right?
Shania La Vida, ladies and gentlemen. That's that
Jenny LaRoche, everyone.
Oh, you're the best. You're the best.